Last night we were notified of 2 new cases of COVID-19 in the Christchurch area. After considering the public health risk assessment this morning, the government's agreed to hold Christchurch at its current alert level setting of alert level 2. The 2 individuals concerned have had no major exposure events and close contacts have been identified and are self-isolating with their test results pending. The pair concerned are being moved into MIQ today.
So today there are 89 new COVID cases in the community to report. Of these, 83 are in Auckland, 4 are in Waikato, and as the Minister emphasised, 2 are in Christchurch. I'll come back to those 2 with a little more detail shortly. There is one further case today in an MIQ worker, which is being investigated to determine whether it is a community or a border-related case. So the total cases then in the outbreak centred in Auckland is 2,921 to date. There are also 7 new cases to report in recent returnees in managed isolation facilities. Today there are 37 people in hospital with COVID-19, all in the Auckland region, and 5 of those are in intensive care or a high dependency unit. Turning now to the 2 cases in Christchurch, as has been mentioned, they are both from the same household. One, as you will know, recently travelled to Auckland to provide childcare for the whānau there. That person had had a negative test before travelling to Auckland and then a second negative test before returning to Christchurch on Friday the 15th of October. They were not considered to be infectious during their travel back to Christchurch. Both these cases became unwell last week, were tested on Tuesday this week, and both positive results were returned last evening. The second case works as a truck driver, and the company that this person works for is assisting with tracking his movements and whereabouts over the 3.5 days that he was working while either potentially infectious or symptomatic. We do know the person at this stage was driving around the Christchurch area, including some trips to just north of Christchurch. In terms of close contacts, there are 3 households with a total of 9 close contacts who have been identified. All are isolating and being tested presently. The cases are now in a managed quarantine facility, I can confirm, in Christchurch, and the local public health unit continues to interview them to identify any other potential close contacts or exposure events, and whether any of those exposure events are locations of interest. So I just urge people in Christchurch, indeed around the Christchurch area, to keep an eye on the Ministry of Health website. We will publicise any locations of interest. I'm also, of course, asking the people of Canterbury, particularly those who live in Christchurch, if you have any symptoms at all, it could be COVID-19, no matter how mild, and no matter whether you are vaccinated or not, please do get tested. An update on Waikato. There are 4 new cases, as I said, in Waikato today. 3 are in Hamilton, 1 is in Otorohanga. All are known contacts of existing cases and have been contacted by public health officials already. So in the total number of cases in the Waikato outbreak, there are just 3 now that haven't been epidemiologically linked, but they have been genomically linked to the outbreak there in the Waikato.
Over the last 18 months, our managed isolation and quarantine facilities have been our first line of defence against COVID-19. Stopping COVID-19 at the border has been one of our highest priorities, and thanks to the hard work of thousands of dedicated Kiwis, we've been able to enjoy levels of freedoms over this past year and a half that have been the envy of many other nations. Over 183,000 New Zealanders and others have entered the country through managed isolation and quarantine, MIQ. Over 1,350 of those people have carried COVID-19 with them, and yet we've only had a handful of incursions into the community during that time. So as a country, we owe a massive vote of thanks to our frontline MIQ and border workers. They've done an amazing job going to work each day in a high-risk environment, keeping us all safe. But now, as we enter the next phase of our COVID-19 response, it is time to reconsider how we're managing our international border. As vaccination rates have increased internationally, the number of COVID cases being picked up through our MIQ facilities has continued to decline. We now only get 2 to 3 cases per 1,000 arrivals, and only around 1 in 2,000 is detected after 7 days of isolation. In addition, Full vaccination will be required for all non-New Zealand citizens travelling to New Zealand from the 1st of November. With increasing cases in the community, the overall risk profile has changed. MIQ is playing an increasingly important role in providing quarantine and isolation for higher risk community cases and their contacts. Unlike most recent arrivals from overseas, these people actually have COVID-19 or they've been recently exposed to it. That's why the government's been considering how to rebalance our MIQ system to ensure that Kiwis can continue to come home whilst we also provide more spaces for those higher risk community cases and their contacts. We are also very aware of the pressure that's been building at the border as the world begins to reconnect, and increasing numbers of New Zealanders here and abroad want to be able to reconnect with their loved ones. So now's the time to start stepping out a series of changes to our border and to our MIQ arrangements. Step 1. MIQ stays will be reduced from 14 days to 7 days. Travellers being tested at day 0, day 3 and day 6 and undertaking a rapid antigen test before they leave MIQ. They'll then isolate at home for short periods of around 3 days. They'll get a PCR test on day 9 since they returned home, and they will wait at home until that result comes back. This is consistent with the way we are now treating contacts in the community. This evolution will free up around 1,500 rooms a month in MIQ. Many of those will be used for community cases, but some will be re-released using the MIQ voucher system. I expect next week that the next release will have over 2,000 rooms. These arrangements will apply to all travellers arriving in New Zealand from the 14th of November. The second step allows us to reopen the border to more low-risk travellers, allowing them to bypass MIQ altogether. And we'll start with travellers from low-risk Pacific Island countries, such as Samoa, Tonga, Vanuatu and Tokelau. We've already welcomed RSE workers from those countries without issue. This one-way quarantine-free travel will commence from the week beginning the 8th of November. Travellers will need to be fully vaccinated unless they are New Zealand citizens. RSE workers who are currently able to enter New Zealand with at least one dose of the vaccine will need to be fully vaccinated from the 1st of January. The third step is we can move towards having more people isolating at home. This option will be made available to increasing numbers of fully vaccinated travellers in the first quarter of 2022. However, our priority at this stage is to safely transition to the new traffic light system first and bed that in before adding the additional risk of international arrivals immediately entering the community. When the COVID-19 protection framework is bedded in, 90% of eligible New Zealanders will be fully vaccinated, so we'll have a higher level of confidence than we do right now in allowing international arrivals to go straight into the community. The length of time that people are required to isolate at home will depend on a number of factors, including what more we've learned about dealing with Delta by that point. The COVID-19 situation continues to evolve rapidly, both here and abroad, and we do need to move quickly to make sure that we're minimising the risk we face in the best way possible and that we're devoting our resources to the places where they can make the biggest difference. We will, as we always have, step through changes carefully though. In the meantime, my message to all New Zealanders, whether they're here or abroad, is a very, very simple one. Get vaccinated. Then we can all get back to doing the things that we love and to seeing the people that we love.